Welcome to Your Infinite Health. Are you getting older?
Are you feeling it?
How would you like to do that in reverse?
We're your host,
Dr. Tripp
and Lene.
We've run an integrative medicine practice for 13 years.
Together, we have 60 years of combined experience helping clients.
We've helped tens of thousands achieve success in health and live longer, happier lives.
In this show, we'll cover peer-reviewed and evidence-based integrative approaches to creating the health you've always wanted.
We also share professional experience we see in the field every day.
So if you're ready to feel, look, and live your best life, you're in the right place.
Welcome to Your Infinite Health podcast.
Hey guys, it's Lene here. I have a great episode coming up with an amazing interview with a regenerative medicine physician out of California. So excited to have her on and hear what she's doing in California. And Tripp was supposed to be on with me, and he may be popping in, I don't know, a little later, but true to form, he scheduled a regenerative medicine procedure for a lady that was in pain. Looks like she's having back pain and something going on with her hamstring. So he's actually held up in a procedure at the moment. So it may just be me and our amazing guest, but I hope you stay tuned. All right. Thank you so much, guys, for jumping in with us. Again, as I told you earlier, I'm so thankful and excited to have this guest on. Dr. Prudence Hall is her name, and she's really interesting because she started out as a traditional gynecological surgeon. It's a mouthful. And transitioned actually her career to focus on regenerative and integrated medicine. And she's the founder of the Hall Center in Santa Monica, California. She saw a critical need to address the problems confronting women and men experiencing these stubborn and often debilitating symptoms associated with aging. Her practice is focused exclusively on regenerative medicine now, looking into the root causes of conditions and diseases rather than simply treating symptoms. She strives to help her clients achieve optimal health and actively prevent disease without the use of pharmaceutical drugs when appropriate. As a health consultant, she strives to help clients achieve optimal well-being and actively prevent inevitable decline using proven natural. I don't know. Does it have to be inevitable?
Yes.
We'll have to get into that.
I don't think that it's necessarily inevitable by any means.
Yeah. We might need to change that.
That
word.
was not my wording.
Okay. We're gonna have to fix that.
Prevent many of the diseases of aging.
There you go. Using natural regenerative medicine. And she's also the author of Radiant Again and Forever. Welcome, Dr. Hall.
Oh, so delighted to be here with you, Lene. It's we're in a similar field, and I can't wait to have our conversation.
Yeah. So as I was telling the listeners earlier, and you was hoping to have Tripp on the call because I know that he would love to chat with you because y'all are of like-mindedness. But he, being the healer that he is, scheduled a regenerative procedure last minute yesterday for a lady having pain in her back. So he's actually doing that. But maybe if he gets done, he can pop in. We'll see how it goes.
Well, it'll be a ladies' discussion unless he comes.
There you
which
go.
Is absolutely perfect.
Go. So tell me a little bit about your history. So you started out as a gynecological surgeon in California, and how long have you done that? And
yes,
what
I was. I went to USC for my medical school, and then I went to the big hospital associated with USC and Keck School of Medicine, and that was the big county hospital where I did my OBGYN residency. So the OBGYN residency is, delivering babies, and it's a lot of surgical training. And I did that about 3.5 decades ago. And I went into obstetrics and gynecology because I have three sisters. So
Oh,
there are four girls in the family. And finally, thank God, my younger brother came along. But we were raised right when the women's movement was blossoming into this very powerful women help women. Women can take control of their lives and help to really direct it in more positive and powerful ways. So this love of, in terms of looking at, what is my bliss, what is my purpose, I realized it's helping women, and it's helping women to become just powerful beings and beautiful beings and healthy beings. And I have really devoted my professional career for the last three and a half decades towards that. Um, and it's been very, very rewarding. uh, Lene, I went into private practice. I thought that I knew everything. I mean, I was dealing with the sickest, most needy,
oh,
complicated patients, really, that could ever have imagined. Coming across the border from Mexico, and very,
oh,
very little health care and we provided that kind of health care, very frequently emergency care. So I came out of my residency. I thought, I got this. I got this. Doesn't matter what it is. I got this.
right.
Abortions that go bad. Bad, whatever.
Mhm.
And then I started meeting my menopausal women. And they would say, I have hot flashes and I'm crying all the time and I hate my husband and I have no sex drive. And Prudence, I'm turning like an apple that's rotting. It's like these
Right.
terrible images they would tell me about, and the real despair and the 50 pounds of weight and sleeplessness and hot flashes. And, I was trained. I thought, great, I'll give them what I was trained at USC.
Oh,
And it failed. It failed very,
what
very
was that
badly.
treatment? From a gynecological surgical perspective, what does that look like?
Well, it didn't involve surgery. So that was one
Oh, okay.
aspect of being a gynecologist, being an
Okay.
OBGYN, an obstetrician. But I was using Premarin back in 1982 and 1983. And Premarin is pregnant horse's urine. And
Hmm.
it was created in the 1940s. Now, before 1920, there was not even a word hormone. There wasn't even penicillin. I mean, it was just starting to be. So it was really the very beginning of Western medicine when they created this. They put catheters, little tubes into the bladders of pregnant horses. I know it's very abhorrent. And
Yeah.
they would drain the urine and kill the horses after their delivery, basically.
Wow.
So I that was the only thing available, and women told me it does not help, and that they were more inflamed. Inflammation is a common cause of menopause, and also many other conditions, but menopause gives rise to a lot of inflammation. And when they started returning, telling me they didn't have the results that I thought they would, or I assumed they would, because I was in the clinic at USC, the menopausal clinic, and we treated, and that was it. And I never saw them again. That was the problem.
Hmm.
So I started seeking out other possibilities and solutions for menopause. And then that opened the door to integrated medicine. And
Hmm.
I was, when I found Jeff Bland, the father of functional medicine, I don't know how many years ago. It's many, many years now. I went up to Giggs Harbor, and I was one of maybe 30 or 40 people taking his functional medicine class. He is a phenomenal, phenomenal leader of the functional medicine movement, which is now when you go to his classes, there are 3,000, 4,000 people in it. So
Wow.
it's really caught on like fire in terms of this is the way to approach a patient with
Hmm.
great success.
So when did you so I know for us, because we transitioned out of medical oncology and providing chemotherapy into preventing cancer. And I remember the day that we sold the chemotherapy chairs. Had some really nice, they're luxe, man. They massaged and heated and had all the bells and whistles. And I sold them to a community hospital. And when they came and got them, I was like, well, no turning back now. We're moving forward. And we started integrative medicine in a community. We're only integrated medicine there. So it was
Mm.
new. It was misunderstood. There was a lot of education that had to happen. But I remember that moment when those chairs were gone. I was like, oh, here we go. So did you have kind of a moment like that when you knew that there was no going back?
Well, when I realized that I had kind of failed in my mission to help a huge amount of women, I was torn. I wasn't sure whether I should change my field and go into
Mm,
something different, even though I was very, very pulled to this, to this life purpose. And it wasn't really until I started getting the excellent results that I get now with treatment that it's like there is no going back. And now I
right.
can promise women, especially women who are in menopause, that there are solutions. They will not be left by this. That they will become. They will have the opportunity really to choose different pathways and different things that they need to do in their life rather than being a prisoner to their hormones in their body.
Hmm.
So yes, there's no going back. It's
No going
been
back.
almost 30 years. It's no going back.
Yeah.
It's going forward. It's a
So
great horizon, open horizon still.
it really is. I mean, there's so much opportunity, and I think what's really exciting to see slowly but surely, um, how Americans approach their health is shifting to be more ownership interest, and um, as they become the CEO of their health and not the victim to whatever the
Right, right.
traditional approaches
Excellent.
are. Um, so, well, that's cool that you transitioned and then no going back. So what does that look like in your clinic, for a woman who, maybe starting or going through menopause? What can she expect when she comes to see you?
Well, I approach medicine on several different layers. So one is the pure physical layer. The other one is the emotional layer, which is very, very important to women who are in menopause because they're devastated with anxiety and anger and terrible depression. Many of them have been treated with antidepressants or Adderall because their brain is not functioning well. With
Mm,
lower estrogen, there's much more brain fog and dementia. So um, I want to address that mental aspect, the emotional aspect, and then the spiritual aspect, which is the
mhm,
connection to consciousness, the connection to source. Who am I? Who, why are they here? What is it? I mean, as Joseph Campbell says, follow your bliss. What is their bliss in life? So to start with the physical, I send them a lab slip. They get all their labs done, and those lab slips are looking at the ovarian hormones, and there are four ovarian hormones I look at, the thyroid hormones, and there are about five thyroid parameters that I look at. Then the adrenal stress hormones. Those are very, very important because we're a completely stressed out society, and menopause causes it's the most stress that women can ever really endure, unless they're in a war like we're in now.
mm.
Unless we're in a
Interesting.
war or really in a life and death situation. And I look at the markers like inflammation, the small dense cholesterol particles to see if they have a increased likelihood of having a heart disease or stroke. Um, and I look at some of the parameters of aging, like their sugar, their hemoglobin A1C. And that's how much damage do I have in my body due to sugar over the last 4 months. So checking in on a hormonal basis and then on kind of a general how you doing level. And I identify early patterns of diseases that are beginning to occur. For example, many of the women I work with are already pre-diabetic or diabetic. So when you're in menopause, when estrogen is low, up goes the sugar. When estrogen is low, up goes stress. So the stress hormones are blown out. It's
Mm,
fight and flight, and we're in both in menopause. Then when estrogen is low, up goes the LDL cholesterol with all the small dense particles. I look at the ApoB and the LP little a and all of those. And up goes inflammation. So we're in a state that is that is propelling chronic diseases.
Hmm.
I mean, it's menopause. I consider menopause a death process, really, because
Well,
once it
I
starts,
know when I was growing up, my my exposure to menopause as a child was my mother in the 80s, and I have to tell you, I wasn't afraid of anything except for menopause. Menopause
yeah,
and spiders was my
yeah.
number one fear, but luckily I married a guy who's optimizing my hormones, so I don't go through any of
Oh,
those things.
wonderful.
I
I am so
manifested
sorry
that.
about your mother. I'm so sorry about your mother. There are
Mm.
women that I see who are, menopause will start now around 44 to 48, maybe 49. It's very rare that I see menopause start in our 50s. So there are women that I see who are 75 who have endured really unbearable suffering for 25 years and they
Well,
haven't been able
yeah.
to find treatment.
Especially, I know for a lot of women that have those hysterectomies when they're really young, in their 30s and even early
Yes.
40s. I mean, that just jacks up everything.
That's right. That's right. But now we have bioidentical natural hormones, and we've
Hmm.
had them for quite a long time. You use them, is that right?
Yep.
And Trip is, uh, you and Trip are prescribing them for people, which is absolutely fabulous. I'm so happy to hear that.
Yeah, there's no other way to go.
Well, I think it's the most effective way because it lowers the risk factors for chronic diseases, and it just is so effective in terms of eliminating symptoms of menopause, which are just really, as you well know, really, really bad. And
Hmm.
women come to me and they haven't slept in years and they're ravaged by sleeplessness, a couple of hours a night. And they'll get their children off to school and go back to bed until their kids come back from school. I mean, I
Wow.
was talking earlier with a patient today, a new patient. I see new patients generally in the morning, and she was on the verge of getting divorced. She had zero sex life, no ability to have orgasms. She had gained 35 pounds, and she said, "I've turned into a monster. I'm screaming at my kids. I'm crying all the time. People are terrified to come near me, and I don't want them to." So one of the symptoms of menopause is isolating oneself. We can't stand any chaos or noise or we're very sensitive in menopause. And women tell me, I just want to go away for a year and listen to the waves in a little hut on the beach. And, you can't live that way. It's really living with a war zone within your body.
Mm.
And she's not going to live that way. It'll take probably 3 or 4 months to really get her back to vital and happy and to get her off some of the meds that she's been put on.
Right.
But it really is strong. And acupuncture is helpful, and
Hmm.
homeopathy is helpful. That this helps to calm the brain and calm the mind. Herbs work well, but there's nothing like bioidentical hormones.
True story. True story.
Mm.
So you do the BHRT and then but then you also do regenerative approaches. So what do those look like in your practice?
So one of the ways I got into this whole menopausal thing was that women would tell me that their digestion was terrible. They'd say, I have acid reflux. I'm bloated like I'm 20 weeks pregnant. I can't eat a lot of stuff. I'm down to eating 5 things. And so I didn't realize at the time that gut imbalances like this and pain was a menopausal symptom.
Hmm.
So much of the gut problems went away once women's hormones were rebalanced, all of those hormones. I don't just balance the ovarian hormones. But then there
Mhm.
was a certain amount of women who continued and persisted to have gut issues. And we know now for 20 years how important the gut is, maybe more than 20 years, but how important the gut is in terms of our general health. And that has to do with the biome, the good friendly bacteria that we have. It has to do with eliminating parasites, adding digestive enzymes if we're on a plant-based and lots of raw food, or just in general. So we run tests, which are actually very inexpensive, and we're able to look at the gut microbiome as well as parasites. And my daughter is a naturopathic physician. She practices with me, and she
Nice.
rebalances the gut. And then the second thing is there's a lot of, so in terms of rebalancing, it's like I said, it's the digestive enzymes, the acid, the eliminating foods that are intolerant. And the top intolerant foods would be gluten. That's with wheat and bread, things like that. Gluten, dairy, soy, nightshades, and corn, surprisingly. I mean, that
What's a
one surprised me.
nightshade?
A nightshade is things like tomatoes and
Oh,
peppers, eggplant. So
eliminating
those,
eggplants and tomatoes. What?
well, we don't necessarily have to do that. Dr. Gundry says that the worst thing about some of these nightshades are the seeds that are in there. He's the
Okay.
lectin man, the lectin diet man. But we really work with our clients to find a healthy diet, to clean up and to help regenerate the GI tract. And then so much of the body pain that's arising as we age is quelled. And
Mm.
the woman this morning, her name was Andrea, said, I'm a tin man. I get out of bed and I'm a tin man. I can't bend my knees. Everything
Oh
hurts. My
no.
joints hurt. My back hurts. And it's like, okay, we're going to get to the core root cause of the inflammation. Most of it is
Mhm.
probably menopause, but it could be gut. And then the toxicity. We live in a very, very toxic world. So toxicity hurts the mitochondria, which are the powerhouse little pods within each cell. And so we work with mitochondrial resuscitation and eliminating toxicity. I have just a great patient who's a pilot. And she's been a pilot for 25 years. So when her toxicity test was done, she had styrofoam, massive amounts of styrofoam,
Oh my
massive
God.
amounts of jet fuel. And
Oh shit.
so she went through a big detox process and is now much,
And
much,
that
much
was
better.
just from being a pilot. How is she going to protect herself from that? Maybe stop
Well,
eating
luckily she
styrofoam
doesn't have to
cups would
be a
help.
pilot. Yeah, she didn't have to be a pilot too much longer, and now
Okay.
she's. But
Stop
yeah,
huffing
I
the
mean, look,
fuel, lady.
yeah, well, look at all the people who are exposed to asbestos and Roundup. Roundup, it's in all of our cells. They've
Yeah,
done
I know
fat
around
biopsies.
here in New Orleans in particular, we get a lot of calls of concerns about mold in particular.
Oh, mold is a huge toxicity. That's really a problem.
Hmm.
Really, really a problem. And approaching mold is not my specialty, but Dr. Britton is very good with it. And then I do referrals to people who that's all they do is mold.
Hmm.
So I liberally refer to lots of different people. For example, I wouldn't dream of doing what Tripp does. Dr. Tripp does,
Right.
or I wouldn't be injecting with stem cells and
Oh
I mean
no.
all the things that he does. No, no, I believe that not believe, I know that when we use the best people in their field, where that's really where they excel and love and deal with all the time, that's the best results. I don't want to do anything that's less than really what I do the very, very best.
I have to give you credit for even acknowledging that or saying that because I feel like we run into a lot of providers that think they can do all the things all the time. I think it's a really great, amazing physician that can acknowledge that they don't do all the things all of the time and have the capacity to acknowledge that somebody else may be better and refer.
Oh, yes. Well,
So,
thank you.
yay,
And when
you.
I think about when I think about the emotional problems that result from the trauma that we have in our lives, as much as I'm, really feeling the pulse of women, they need somebody who is trained highly trained as a trauma expert or
Hmm.
as an analyst or so that helps to address a lot of the mental and the emotional problems, because the trauma in menopause that we've had from children really starts to resurface. So
Mm.
1 out of 3 women has been abused, and it's a little bit less for men, but still it's quite high in terms of the amount, um, sexually abused. And that sexual abuse will start to come to consciousness in menopause.
Mm.
And so they're left not only with trauma from the past, but trauma from trauma from menopause. So I I vet people very carefully before I refer them to. I mean, I have a small group of really excellent people that I use, and now you will be on that list. Really,
Oh, well,
I'm so
thank you.
impressed by what you're doing. Just
Yeah.
really grateful.
Likewise, likewise. So, moving along, you wrote a book. Tell us about your book.
I was talking with Suzanne Summers one day. So
Oh my gosh,
Suzanne
were
is
you
just
really? That's awesome.
look. She's an incredible, inspiring presence in the field of health, and I love her dearly. And she was saying, and she's put me in a number of her books and as interviews and things. And being interviewed by Suzanne is really fun, really, really fun. So anyway, we were talking. She said, "Prudence, time to write the book." And I said, "Okay, what's the book?" And she told me how to write the book. And I came
Nice.
back about 4 months later. I said, "Suzanne, I wrote the book." She said, "Prudence, this is not the book I told you to write."
Oh,
It's like, "It's not?" She said, "No, no, this book." So then I wrote the book that she so kindly requested that I write. And I called it Radiant Again and Forever. And
radiant again and
so I
forever.
really want to give her a huge, thanks for encouraging me to write about. And what I did was, here's the chapter on menopause,
Hmm.
and you're in my consult room listening to a real patient talk and how I talk back to them, and how their problems resolve. And at the bottom, here's what I did. Then there's thyroid. You know how many women have undiagnosed thyroid disease?
All of them.
Well, certainly all the ones we see, right?
Right.
40% of women can go to 3 different endocrinologists or their family doctor or their internist, and they will not be diagnosed with a low thyroid, hypothyroid state,
Wow, that's crazy.
because the blood work, the
Well,
blood
they're
work's only
yeah,
one
they're
way
not
of
they're
looking at
looking
things.
at yeah, I mean, generally physicians are looking at a nominal amount of blood work and they're looking for normal values. We actually don't want anybody normal. We want them optimal and we know how to get them optimal. So, yeah,
That's right.
that
That's
needs to
right.
change.
Yeah, that needs to change. So there's a chapter on the thyroid and the adrenal stress and on sexuality, and do hormones cause cancer? And the answer
Oh my
generally
God,
is absolutely
big
not.
issue. Yeah.
Yeah, yeah. They're considered to be, well, very safe. When I look at my patient population, and now it's we stopped counting, but it's beyond 30,000 now that I've worked with for over the last 3.5 decades, probably more like 40,000, and I have 4 women who have experienced a heart attack. Now, that's the most common cause of death in women, right?
Wow.
And they're all alive, they're all well, they're all happy. One of them, they didn't even really know if she had a heart attack, but I included her in my
To be
statistic because I want to be
conservative.
very yeah. So this is one of the effects of the hormones, is that it lowers the risk factors for heart disease and for cancer. So when you look at a lifetime of 1 out of 7 or 8 women over their entire lifespan getting breast cancer, and you've eliminated inflammation, you've lowered their sugar levels to ideal youthful levels, you've lowered their LDL cholesterol and helped their gut to heal, and they're eating a great diet, they just aren't going to get much breast cancer. So
Right.
I do see breast cancer in the center, but not much of it, not where the national average is by any stretch. And
That's awesome.
I do treat women who have had breast cancer with bioidentical hormones. I always have an oncologist uh, consult with them and make sure that they agree with that treatment.
Hmm.
And it's very different using the Premarin and Provera. Provera is a synthetic progesterone, and Premarin is 35 hormones that come from that pregnant mare's urine. Okay, so the incidence of breast cancer was very high when women were using Premarin and Provera. And this was, in the 1950s, 60s, 70s.
Right.
And recently they did a study that showed that if you're only using Premarin alone, the incidence of breast cancer is decreased. So that's a terrible hormone in my opinion. It's not an I shouldn't use the word terrible. It's not an ideal hormone. It's a
Mm-hmm.
hormone that our mothers used, our grandmothers used.
Well, because
They
the
lived long enough.
information wasn't available at the time,
Yeah.
unfortunately.
So if that hormone can decrease breast cancer, what do the natural bioidentical hormones do? Much better. So the studies
Yeah.
show that, and it decreases things like dementia. Dale Bredesen is one of the revered Alzheimer's disease researchers in the world, and he's personally told me, keep using estrogen. It prevents dementia. It helps to prevent Parkinson's, helps to prevent ALS. Um, we don't want to get to the height of our glory as women and start losing our minds. We want to
Right.
stay healthy until our last breath.
That's right. Absolutely. So, what is like one thing that you would like all the lady listeners to know?
Oh, that's such a good question. Thank you, Lene, for that question. It's really important. So, I would say the first thing I want them to know is to be very aware of the symptoms that they're experiencing, because perimenopause starts in our mid to late 30s. And that's when the estrogen levels are just a little bit lower than they are in our early 30s and 20s and teens. So be aware of the symptoms that are happening in your body. Don't let anyone tell you that it's made up, it's in your mind, it's you just need an antidepressant. Don't let anyone tell you that. Get your hormones checked. Now, the symptoms to look for are awakening at night and not being able to go back to sleep, or just very light sleep or difficulty going to sleep. Hot flashes, that's where you just feel whoosh, you're kind of soaked. A lot of women don't have hot flashes. Periods can be absolutely normal, and women can still be in full-blown menopause. I mean, I'm checking their levels, and it's like they have zero estrogen. Their brain hormone, the FSH, is 100. So it's don't feel that just because the period is normal, you can't be in menopause. And depression and anxiety and low sex drive and weight gain. Average amount is 30 pounds, but I see 50, 60, 70 many times. And brain fog, and so be aware of the symptoms that you're experiencing. Bad PMS, that's the beginning of it. Women will tell me, yeah, I used to have PMS for a day or two, and now it's for 10 days. So those are the symptoms. Get help. Go to your gynecologist or to your functional medicine practitioner, and have your hormones checked. Please have them check the follicle stimulating hormone, because that's an important one that I would say nobody checks really in terms of diagnosing menopause, in terms of following menopause. But also their estradiol, and check the thyroid, even though they might miss the thyroid, have it checked. And then if they're told that they need to go on the birth control pill, run. That's the worst
Run
treatment.
away. Yeah, it
Yeah.
is.
I mean, I spent hours talking, please don't take the birth control pill. Please don't take the birth control pill, because I've measured really thousands of women, young women, on the birth control pill, and their hormone levels look like they're in menopause. So that worsens menopause for most women. I'm not,
We had a
I
patient the other
definitely not
day who was in her,
anti-pharmaceutical.
yeah, she was in her 50s and she was still on birth control, been on birth control since she was 16,
Yeah.
taking birth control from the time she was 16 till she was in her mid 50s. What the what?
Well, yeah. So I would consider that mismanagement of menopause, and then if your doctor sadly doesn't have the time to deal with menopause, or doesn't know how to deal with it. And I didn't when I came out of my residency. I didn't know. I'm not throwing any stones, but find someone who does. And functional medicine people tend to be very, very good with it, and gynecologists are starting to be much more active with that. So Prayers that your gynecologist is going to recognize it, treat it, not demean you. So many women tell me, "Oh my God, my gynecologist is telling me that I'm going to cause cancer and die because I'm on bioidentical hormones." And it's like, well, look,
Yeah,
ignorance
that's a
is
pervasive issue, and it compromises confidence and care when you've got a gynecologist who is not current on the studies and the real information that's out there, but relying on old bad data. It
very,
causes
very
all kinds of
old,
problems.
not good data. And
Yeah.
also, I would tell women who are not in menopause that melatonin is a wonderful hormone. It's anti-inflammatory, and also it's a antioxidant for the brain. So some of the top neurologists are really talking about this a lot. And to try melatonin to get better sleep. Sleep is very important. That's when we detoxify our body. And I start with 5 milligrams and rapidly go up to 10 or 15 milligrams at night. And if you feel the effects of melatonin when you wake up, take it 2 or 3 hours earlier. That's fine to do that. And to help your thyroid to function better, you can take iodine drops,
Hmm.
or eat seaweed, or have 3 or 4 Brazil nuts, which has lots of selenium to optimize your thyroid. So these are things that you can kind of do naturally to, really, I would say, rebalance the body and to rebalance the hormones. And of course, the diet, a plant-based diet. With protein, we need about zero point 0.8 grams of protein per kilogram. And we're eating usually about double or triple that. So we don't
Wow.
want to eat too much protein. But the diet is important too. And to
Yeah,
be
it
happy.
all is. It all works together.
Yeah, and to be happy and to love and to to be in service to people. These are sure ways of healing ourselves when we're helping others.
Awesome. Such great, rich information. Thank you so much for sharing your wisdom and your experience. Really appreciate it.
Well, it has been a true honor to talk with you, and just keep on lighting New Orleans up and doing your good
Thank you.
work, and many, many blessings I'm sending to you and
Likewise.
your people.
Thank you so much. Likewise, for sure. And before we go, can you tell the listeners how they can find more information about you?
Thank you. So the website that I would direct them to would be thehallcenter.com. And if you put in your email into the place that says, get Prudence's free book, we download immediately my book to you for free.
Oh, awesome.
And yeah, and I'm getting together groups of women where I take them through a 10-week process, and they're going to have their hormones balanced and their gut detoxed and all of this at the end of 10 weeks. So I look forward to having some of your listeners join one of our 12 women kind of mastermind to do this.
Love it.
And yeah, I'd love to meet Dr. Tripp.
Yes. Well, we'll have to have you back on so that you can do that and make sure he doesn't, you know, mess up my scheduling.
Maybe I can interview him. We'll see if he's
Oh,
open to that.
yeah, that'd be great. That would be great.
Oh, it's
All right, Dr.
lovely.
Hall.
Thank you.
Thank you so
Thank you
much
so
for
much.
your time. And listeners, I hope you
But
found this informational, educational, inspirational, and until next time.
Thanks for subscribing to Your Infinite Health. I'm Dr. Tripp.
And I'm Lene. Until next time, feel it, look it, and live it.